Good morning, afternoon, and evening, as the case may be. First of all, I just want to thank the AN Governing Council and the Secretariat for giving us this opportunity to share some of our learnings from the data use acceleration and learning studies. The idea is to develop a replicable country-led model to digitalize health information systems and to increase data use. As I go through this presentation, what I really want to do is to present the dual model as we see it now. And please keep in mind that what I'm going to show you is a wireframe. We will be having an advanced model or diagram rather later on, but what the content will not change much. It will just be the presentation. So we'll present that dual model, and then we'll explore how this model can be used by countries. And then we really are interested to know which countries who are presented here would actually be interested in a more in-depth discussion with the possibility of adopting or adapting this model and how it could work in the context of Asia. Some of you might have seen this before, but it's good always to update people and give them the necessary background so that we have a common understanding. Now, the data use and acceleration and learning actually documented learnings from 5 countries. These 5 countries were Burkina Faso in West Africa, and that was done by Cooper Smith, in Ethiopia by JSI, in Tanzania by PATH, in Malawi by Cooper Smith, and South Africa by the University of Cape Town. The idea of this learning was that we should share what works or what doesn't work, and to achieve digital transformation for data use and in order to increase health impact. You will note that what we've done actually is we identified, or the countries rather identified, because this work actually undertook both desk review, going through the country documents, as well as in-depth interviews with those who were involved and those who were seen to be key stakeholders in the data use partnership. Just a little bit about the data use partnership. It was a huge project across 5 countries, supported by Bill and Melinda Gates Foundation. And their idea was to actually just see what can be done on improving data use. Why? Because in Africa particularly, I don't know what the situation is in Asia, but we really have a challenge with using data. Sometimes data is just collected and left there or passed on to the next level without actually using it. But what we want is people to use the data that they collect, use it for decision-making, use it to improve programming, and related to that is making the data available at the right time, making data visible so that whoever needs to use it and can use it. And that's where the e-health comes in. That's where digital transformation comes in. So we found actually the countries identified some enabling factors. One of those, of course, we all know this, are leadership and governance. It's important for leaders to be committed. It's important for leaders to champion. It is even important for leaders to ensure multi-sector engagement across the different governance structures, so that really you do get that cohesion and that collaboration and that added value of synergistic collaboration. So that was identified as a very important factor, and I'm sure it doesn't come as a surprise to anybody. The next level was policy. Policy in terms of the security standards. People are concerned about what is happening to their data. So privacy and confidentiality in data sharing and related legal frameworks really did come out of those country experiences. A strategy, of course, we all know you have to have a strategy. You must define your strategic directions and so on. You can't just blindly implement something. So strategy is key, as is investment. We all know that we need money to do things. We need resources to do things. We need people who are properly funded, where their work environment allows them to do the work that they're doing. And a good work environment requires investment. And so that was, again, identified as a key factor. Standards and interoperability, the enterprise architecture, of course, are featured as a very important factor, because these things must work in a way that is systematic and aligned. The energy, the electricity, the connectivity, all these things came up as issues. Even just the environment, is it supportive or is it not supportive, and so on. So this actually was also one of those things that was very important. Services and application, the technical support for systems and users came out as important. And then, of course, the critical factor, the workforce. The data and digital literacy is very, very important, because we found in our environment, as we talked to countries, that this was really a limiting factor. The number of people who can work on this type of thing is very, very limited. There's capacity issues, there's the motivation issues, there's even the incentive issues of what would make digital transformation happen, and what would make data use actually happen. Then there is the infrastructure. We've touched on this slightly, and briefly with the other elements, but infrastructure really is a very big limiting factor, particularly on our continent in Africa. Basic things like the physical infrastructure, being able to maintain, maintain the equipment that you're using, being able to communicate, being able to have the energy, the electricity when you need it. This is very key, and we found that this could actually be a great limiting factor, especially for health workers, because in the end, they kind of just give up and say, oh, well, I'm not going to get connectivity, and they carry on with their paper, with their paper systems, which are slow, as we know, which take a lot of time, as we know, and which actually duplicate when you're trying to do digital health transformation and you keep your legacy paper systems. It just duplicates the work, and it actually frustrates the worker. Then we have the data use and ecosystem. Again, a very important dimension. The collecting of the data, the management of the data, the feedback loops for data, data use itself, the quality, the accessibility, relevance, accessibility to relevant users, and yes, even the incentive to use that data, the skills that are required to analyze that data, to interpret that data, and to go on, to actually make decisions based on that data. The value that is attached to the data, because you find that if you don't use the data, really, it's of no value to you, because it's not answering anything for you. It's not doing anything for you. And therefore you find that the ecosystem is actually critical if you're going to get data use. Can you just press the down, because I want to see the stars on the various things, the various. Yes, thank you. Why have we started that? Because that was something that came up as a new element. You'll notice that if you look at this, the elements here, they've already been, some of them have been highlighted by the WHO and ITU. But the data use ecosystem is that one thing that this framework or this model actually adds on to the existing framework. The other one is change management. It's really, that also came across because, you can introduce a piece of equipment, but if the mentality, if the attitude towards that piece of equipment is negative, you are not going to get much success. So you may ask the question, well, what were the actual lessons that were learned from this, by the countries from this analysis? First of all, in terms of leadership and governance, it's you need to adopt approaches that fit the project goals, and and flexibility must be maintained, including flexibility to shifts in government. And one of the things that we do see on the continent is sometimes rapid change of government. And often you find that as soon as one person goes and another person comes, it's like starting again. So you must be ready to have that flexibility to actually deal with the issues of shifts in government. And the approaches must fit the project goals. You can't just go in and do something for the sake of doing it. It may not be actually appropriate for your goals. So you have to make that a go, no go decision in terms of adopting the approaches of digital transformation. And the second one is policy. It's important to build on existing health policies and standards and to put in place the governance structures. This is what was missing in some of the countries, and they struggled in trying to introduce those data use activities because there just wasn't a supportive policy, and there wasn't a governance structure that could support them to do that in the context of the country. Strategy, I've touched this on this already. You need, of course, a clear long-term and flexible plans and solutions. Flexible because of the issues identified under leadership and governance. And then if you don't have long-term plans and you don't actually consider the risks very well, the likelihood is that you're going to fail. The investment, ensure the alignment of investments. One of the things we've had on the African continent is a lot of parallel little projects. This one is doing that. This one has discovered the latest this and the latest that. And the sum total of it is that you've got little independent investments, and they're really not achieving anything. Couldn't you use that money better if you actually aligned and maximized the impact of your money, of your resources? And then the other thing is, of course, to develop the funding oversight mechanism. Often these are independent. This one is doing whatever they like. This one is doing whatever they like. And there's nobody really having that oversight to say, hey, you people, if we put A and B together and use the resources that are available together, we can actually achieve more. So you really do need some kind of oversight mechanism to make sure that your investments are working for you in the best way that they can. In terms of workforce, what was observed was that you really do need to increase data use at lower levels. By lower levels, we mean like at health facility level, at the lowest level in the health system, going upwards. Because what you find is, yes, data may be used at national level, but you know what? If people who are producing that data are not using it, they will not see the value of that data. And because they don't see the value of that data, they don't care about the quality of that data. They just want the data to be done and to be passed on. But if you were actually to capacitate the lower levels to be able to not only access the data, but also give them the skills to interpret the data for daily use, then the data takes on a greater value than it would if it was just for passing on. So that workforce capacity in terms of using data is very, very important. That's what we found. The countries found and reported this as the lessons learned. Stakeholder services and applications, you need to engage the stakeholders within the health sector and beyond as they are relevant. And of course, if they see it as relevant, they're likely to support you. If they don't see it as relevant, well, it's just one of those things. They'll politely look at you and that's it. You really won't get much out of it. But in terms of services and applications, really the stakeholders must be engaged so that you can get what you want and the support that you need actually. The data use ecosystem, we've touched this before, but just you strengthen the data use culture at all levels, and you take a holistic approach. You know, we have experienced in Africa piecemeal approach. You know, you improve this, you invest in this little thing, but then you're not looking at what else impacts on what you're doing. So really the entire ecosystem must be looked at and strengthened in terms of data use culture at all levels. And you take a holistic approach. Infrastructure, I've touched that on before, you know, but what came out was that instead of building for a digital ideal, you know, consider ways to work with what is currently in place. Sometimes people want to have those nice things, but they don't fit in the context, and they don't work in their context because the rest of the infrastructure cannot support what they want to do. So rather than building for a digital ideal, the best ideal, try to work within what is currently in place. That was one of the lessons that the countries came up with. And then, of course, the systems architecture, you develop an implementation process and framework that uses practical implementation approaches. Again, emphasis on practicals and suitable for the context, workable within the context, workable within what is available, as opposed to pie in the sky, where you want the ideal situation, which is not tenable in your particular environment. Change management is very, very important because it's a key reason why projects fail. If you don't get buy-in at a political level, you don't get buy-in at the senior leadership level, and I might add, you don't get buy-in at implementation level, forget it. You need to manage the change management. People are threatened by change as a general rule. People are threatened by what they don't understand. People are threatened by things that suggest that they might lose their livelihood. They might be replaced by this machine and so on. So change management is critically important if we want digital transformation. And indeed, if we want proper, good, effective data use. Okay, this is just a wireframe, and please emphasize it's a wireframe. You'll see it probably looking very different by the time our people who are artistic and whatever have finished with it. But what I just want you to see is just the things I've been talking about. You have a population that has to be served. You want to establish a good data use ecosystem, the environment within which data is used. Then you have the workforce. And the workforce is critical, of course, because they're the ones who get things done. But you'll notice that the change management actually goes as an outer circle again. Why? Because change management is needed at the workforce level. It's needed for people working in the data use ecosystem. It's even needed in the population to a certain extent, but more importantly, at the workforce level, because they're influencers. They will influence the clients, they will influence those who supply them and so on. So the change management is very, very important. And it touches actually on practically all the elements that we're talking about. Infrastructure, services and application, policy, investment, strategy, leadership and governance, and systems architecture. So that is how the model is looking like at the moment as a wireframe. There'll be more explanatory things added on and linkages which will come and which will be given to those who are interested in following this up a little bit further. Okay, so we've done all this. Who really do we have as the target audience for this model? Who do we think can use this model and do something with it? You know, who should we develop packages for so that this model becomes actionable and actually inspires change? Well, we're looking at the implementers, of course, because they have to take up this model, they have to implement it, they have to sell it in a way, even beyond the first initial countries. Then we look at the countries themselves, the national governments, they need to align with it. They need to understand what this means. They need to align it with their digital initiatives and integrate the learnings with national strategies. One of the things that we want to emphasize in this model also is the learning aspect, because sometimes people do things, they generate things, but they actually don't learn from it. They don't have time to learn from it. It would be a good idea to make time to learn from what you're doing, because you can only improve as you apply what you've learned. The funders, there needs to be greater coordination between investments and what the country wants, the country's national strategies. At the moment, at least in Africa, we still have situations where the interest is the funders, not the national government. And that causes a lot of pain for the country, because now they can't see how it tallies with what they're trying to achieve. They don't even understand how this piece of work funded by X is actually fitting into what they're trying to achieve for the nation. So really the coordination of the funders is very important. And policymakers, of course, because they need to increase the normative guidance around best practices in digital transformation and data use. A poor policy probably translates into poor implementation. A good policy will support good implementation. So these are our 4 major target audiences for this particular model. So what do these various target groups, these stakeholders, how do they use the model, and what key actions? These are illustrative, they're not comprehensive, they're just illustrative. People can think more when they're actually doing it. First of all, country governments, we expect them to apply the dual model to align digital health initiatives and integrate the model's key factors within national strategies. They will need to establish governance bodies. They'll need to develop investment roadmaps. They'll need to support existing technical working groups and committees. They'll need to develop an enterprise architecture. They need to increase coordination between sectors and regional, subnational and national digital transformation efforts. We can't just have everybody doing what they want. It has to be coordinated and to maximize the use of resources. They need to use data to make digital transformation investments and programmatic decisions. In other words, you want to bring something in. Why? What is the evidence that that thing will actually work in your country? On what basis are you making that decision to bring something new? So those go, no go decisions must be based on data. It's still on country governments, yeah. They must build multi-use digital health systems and tools that are applied across different scenarios, uses, and landscapes. That is much more cost-effective. Design digital and data tools that are responsive to infrastructure challenges and limitations. And then cultivate champions at all levels, motivate and empower health workers, identify and build the capacity of health actors at all tiers to cultivate a culture of data use. And of course, they have to develop long-term country-generated funding streams, because that's another limitation. Somebody else is paying for it. When they say, well, our friendship is ended, goodbye, that is the end of your intervention. So they have to think seriously about how they're going to generate national, domestic resourcing to ensure that there is continuity and sustainability. What about policymakers? Well, we expect them to use the model to champion the development of policies and guidance in accordance with its recommendations. There are very clear elements that have been highlighted, and those things should be actually included in the guidance. So we expect them to develop the guidance and promote, excuse me, sorry, I just, yeah. We develop guidance and promote adoption of 2 new elements. That is the data use ecosystem and the change management. We expect them to use evidence generated from country implementations to define policies and guidance, and to encourage development of investment roadmaps at the country level. Okay, the implementers. For the implementers, we expect to apply the dual model to current and future projects to optimize the impact of digital and data interventions. What critical actions do they need to take? Well, ensure that digital health activities are government-driven by aligning to country strategies, policies, and health visions. You know, you can't go into a country, or you can't be an implementer in a country and just start thinking, oh, this is nice to see, this is nice to do, and you start doing it. If you want government support, show the alignment to country strategies and policies and health visions, because then they see you as relevant. Secondly, apply user-centered design approaches to develop interoperable digital health systems. What is this in user-centered? Involve the people who are actually working, using what you are producing, what you are supplying, so that they can tell you where the pain points are. They can tell you how you can improve it. They can tell you what you can drop, and it's totally irrelevant. So you really do have to involve the users, because what in the end, you want to have good systems that speak to each other, that are interoperable, that are not in silos, but they can actually speak to each other. And so you strengthen the digital health systems. The third issue under this is to build the capacity of health actors at all tiers of the health system to model and cultivate a culture of data use. You know, for example, in some countries where I've worked, there's been a lot of capacity building at the national level, but very little at the district level or health facility levels. So this is critical that you go across the sector, because even if you have a genius at national level and nobody else knows what they're doing below that, it really will not help the country. So that you build the capacity of health actors at all tiers of the health system to model and cultivate a culture of data use. Work within existing governance bodies, the working groups, the technical working groups, for example, committees, and and support the design of digital and data initiatives. Build multi-use digital health systems and tools that can be applied across different scenarios, uses, and landscapes as appropriate, rather than rebuilding for every new environment. You know, you move from one district to another, you start all over again. Think across the board and try to see if you can build something that is generic and maybe just needs a little bit of adaptation here and there. And I think finally, the funding agencies, ensure that these funding agencies really can champion the dual model and invest in programming that reflects the findings of the model. What key actions would we expect from them? They should ensure digital health investments align with the country's vision and strategies. I think I briefly touched on this earlier on. They should work with other funders to align investments and harmonize with country priorities for digital transformation. Thirdly, invest in foundational country-led activities, which include a development of national digital health strategies and roadmaps, policies to support digital transformation for data use, governance mechanisms to enforce new policies, guidelines, and standards, enterprise architecture to define the current and future state. Please go on to the next slide, which continues on this. And there could be advocates for countries to establish governance bodies to oversee digital transformation for data use. They could invest in global goods, standards, and interoperable systems. They could leverage data assessments and evaluations to make investment decisions. They could invest in building the capacity of health actors at all tiers of the health system. They could identify the true costs of digital and data infrastructure and work with the country governments to determine sustainable funding streams. So then that is basically the overview of where we are at with the data use acceleration and learning model. And now I'll hand over to Taonga to just discuss one country and what was found there. Taonga.
Thank you, Dr. Chilunga, and good afternoon and good evening, everyone. I will share an example from two countries focusing specifically on change management, and time permitting may also share something around the data use ecosystem. So just focusing on change management, bearing in mind that some of the lessons learned that Dr. Chilunga highlighted were around considering the political readiness as well as buy-in among senior leadership to drive change as well as to increase uptake. I'd like to share a particular example from one of our countries, which was Malawi, that implemented a data use campaign specifically for change management. So as an example, the government there introduced a data use campaign. These were a few data use campaigns, actually. These were implemented to train healthcare workers on using indicators, dashboards on DHIS2, as well as mobile applications, and to ensure that all health workers had personal login information and were aware of the digital tools that were available to them. Another example is from Ethiopia, in which they built a reward system for health workers and leadership buy-in. So in order to do that, the implementation team in Ethiopia worked with a select number of districts and hospitals to test out a series of digital health interventions for replicability as well as scalability. And as part of this process, they also trialed a reward system within one of the health facilities to better understand how incentivizing might improve data-informed decision-making. And the results of that reward system were presented to digital health leadership in order to improve their confidence in integrating new practices and procedures into the health system. So just focusing specifically on change management, as we saw in the wireframe, that was really one of the elements that was in the middle and linked to everything else within our model. If I have time, I'm not sure, maybe someone can just let me know if I don't have enough time. I can share another example around data use ecosystem that was specific to South Africa. In order for them to make data more visible and accessible and to promote data use, they actually implemented a provincial health data center. This provincial health data center was housed in the Western Cape province, in which person-level data was actually harmonized based on patient identification. And as a result, the data was de-identified, which you have a few minutes. Okay, all right. Which enabled greater data access, helping researchers to conduct health-related research. And in addition to having data in a single environment, allows for efficient data storage and dissemination, and enables the team to provide ongoing technical assistance and data quality loops. I'd also like to share in terms of services and applications, and centralizing digital oversight. One of the countries in which we took the learnings from was Tanzania, and we saw that the Tanzania government will soon be implementing the Center for Digital Health, which will govern and oversee all the digital health initiatives in the country. And it will also seek to make future partnerships and digital systems more coordinated and impactful, and will serve as a knowledge management function. So I will pause there for now, but wanted to share some of those country-specific examples with you. And there are a lot more of these examples that will be made available at a later date across all of the different elements of the dual model. Thanks. Let me pause there.
Yeah, so we've done this. So what next? I think what next is exactly what we are doing now, and that is sharing the model with countries to determine their interest. We are sharing this model with Asia, with Africa, and the Americas. Why? Because we really want to get some countries if they're really interested, to dive in to see whether they can actually try out the model, and we monitor how that works out, and we learn a few more lessons about it and refine it even further, and see how it works out. You know, it's one thing to create something on paper. It's quite another to try it out. So really, we are looking for interested countries. We are inviting interested countries for a more in-depth dissemination, more in-depth discussion, a more in-depth look at how we could actually get this model adopted and adapted and possibly implemented. So if you're one of those countries, there's a Google Doc. I hope Catherine has put in the link in the chat, where you just enter in your name, your email, and just indicate interest. This is by no way committing yourself to anything. It just says you're interested, and we'll get back to you. And at that stage, if you're not interested anymore, you're willing to say, I'm not interested anymore. If you're still interested, then we'll move along with you. I think the next is just a little poll that Catherine will run so that on menti.com, so that we just have a few answers from you, just to hear what your opinions are and how you feel about this.
Thank you very much, Dr. Puta. And welcome everyone. I don't know if this is afternoon or evening, wherever you are. So I'll be sharing the Mentimeter with you shortly. I hope you're all able to see that. We're just going to request you all to get into the link that is showing up there. If you could go to www.menti.com and also type in the code that's showing on your screen. Let's give everyone just a few minutes to get into it. Okay, excellent. So the first question there is, which digital health stakeholders do you think are best placed to help countries transform their health systems using the dual model? I'm sure you've all heard from Dr. Chilunga about the dual model and the digital transformation that we're hoping the countries could adopt or adapt. Do we think it's the country governments themselves? Could it be the global and or regional policymakers? Could it be the implementers that we learned about, including the private sector? Or is it the regional or global funders? Or do we think that all stakeholders in the collaboration would be best placed? Okay, so there we can see we have a few responses. We have some responses coming in. Well, it looks like the majority think that all stakeholders in the collaboration are best placed. The numbers are going up. Okay, maybe I could move on to the next question. Okay, so we learned in the first question that the majority of us think that it's all the stakeholders who should be involved. Now we're going to ask another question, that aside from the stakeholders that we identified in question 1, do we think that there are any other stakeholders who are best placed to deploy the dual model in country? Did we leave out any particular stakeholder that you feel could also be key in deploying the dual model? Okay, there comes one. We're saying the private sector. Have we left out anyone? Are there any other stakeholders whom we could add to, like, all the stakeholders? Okay, so it's just the private sector. Wow, interesting. There we go, civil society and digital health in country. Excellent. WHO, excellent. So these are the other stakeholders that we should include, and these are like the global the multilaterals that we could work with. Excellent. This is the third and last question. At what stage of digitalization of national healthcare systems do you think countries can apply learnings from the dual model? Do you think this would be in the early stages, somewhere along the way, or do we think it would be right at the end? At what stage of the digitalization of national healthcare systems do you think countries can apply the learnings from the dual model? At least we feel that, you know, the best placed stakeholders in country are all the stakeholders. They should generally be engaged. And we also learned that other stakeholders that we could include in this include the civil society and the private sector, including the multilaterals and the bilaterals. So here we are, we have some are saying in the early stages, as early as the planning stages, early and mid, nascent to maturity, just select what is appropriate for the country. And others are saying early stage, from the initiation stage, very early. So suffice to say that the majority of us think it should be done in the early stages. Thank you very, very much. I'll rest my case here. Let me stop sharing in case we need to. Thank you very, very much.
Thank you, Catherine. Thank you for that little teaser to make us think through, but I think it's also an eye-opener. I will go now to the question and answers. If there are any questions or comments, addition, I mean, it doesn't have to be a question, can be a comment.
Hi, Chilunga, Fazila here.
Okay, there's Dr. Fazila, go on.
Camera's not working. You know, most of the elements are from the WHO 7 element. I was wondering, yes, data use is new. The change management, why is not part of workforce? Or, you know, why did you have it distinctly?
Okay, well, I think change management goes beyond the workforce, because sometimes you actually have to deal with those who make decisions. That's what we found in our environment. The workforce may be agreeable, but they don't get the support of others because they don't see the relevance of that. So we found that it went beyond just the workforce.
Okay, thank you.
Chilunga.
I can see Dr. Alvin is about to.
Yes, thank you, Chilunga and Catherine, for presenting the dual program. As Dr. Fazila mentioned, it's built on top of the WHO IT National E-Health Strategy Toolkit. So my question is, will you provide resources to countries who decide to adopt or test the dual model? I think there might be some resources needed to execute this program.
Yeah, you're right, and Dr. Alvin. In fact, we made a point of building onto, as the results were coming in, we made a point of building onto the models that were already existing, either to validate them or to add on. And I think we validated the ITU WHO framework because most of those things, as you rightly say, are there. I think we just added on the new ones, that's all. They're not even new, we just included them because they came up. As of now, we cannot speak of having funding to implement, but I think this is something that probably will be discussed as the advocacy team go forward to advocate for the implementation and for the uptake of this model. You notice that one of our target groups is the funders, is a funding agencies. So hopefully, as the advocacy group works, maybe we'll be lucky and strike some funding, but it would be a lie to say that right now there's funding. It's something that we hope will come as a result of the advocacy activities.
Okay, thank you. I think that if the funding is still to come, I think it would be the research institutes who would be very interested in adopting dual, because they're inherently, this is the nature of their organization, to test out concepts and frameworks like dual. So the Health Data Collaborative, which you are familiar with, has a research, academia, and technical constituency. And that's a huge, just a long list of research institutions who are doing research in digital health. Maybe that's one group that we can sell the dual framework, and one of them might might already have some funding and they can adopt the framework and implement it. So you already know Muenya. Muenya is the HDC secretariat. I used to chair or co-chair the research academia and technical constituency of the HDC, but now I'm just a member, but I can connect you to the new co-chairs.
That's great. Yeah. Yeah, we are on the HDC, and actually they're very excited about this. So you're right, Alvin. I see a question from Jovita. Yeah, I see. Do you have learnings or challenges in ethics in digital transformation? Yes, there are plenty of those issues, and that's why the issue of policies that address data privacy, that address confidentiality, came up in the discussions. And those are things that countries are grappling with still. And those are things that need to be addressed by the policymakers and the governments. But yes, there are challenges there because people are worried about their data and what happens to that data. Well, it seems as if there are none. I think my last appeal is just for people to fill in, to sign up on the Google Doc link, which Catherine has put in the chat. And it remains for me just to say, well, thank you so much for your time. And I particularly want to thank the AHIN leadership and secretariat, because I know this is a very hard time for you. You have a lot of things to do, and we thank you and appreciate your support very, very much. We do not take it for granted. Thank you so much for this opportunity. And I hope that there will be at least 1 or 2 countries that will be brave enough to move forward with us and see what we can do with this model. Again, this is building on work that others are doing. It was never intended to be something new. It was just intended to pick up everything that countries saw as important from the experience they had in implementing the data use partnership project. So thank you very much to all of you. And yes, good afternoon, good day, good evening, whatever your time is. Sorry, Manila, we kept you awake. We hope now you can go to sleep.
Thank you.
And enjoy the rest of the evening.
Thank you.
Thank you so much. Thank you.
Thank you. Bye. Have a good
Bye.
evening. Bye-bye. Thank you.
Bye.